So what do we know about solutions at the school and the neighborhood levels? There are a number of examples of programs that have been responsive to this specific question, and they will be identified and highlighted as we proceed. What do we know about solutions? There are several strategies. The first strategy is that we should look to strengthen and design schools to meet the needs of students who live in concentrated neighborhood poverty. A number of people have been involved in the work of resolving issues related to students who live in neighborhood poverty and who find themselves affected by their circumstances. This is a population of students who find that their academic success and their achievement levels have been greatly affected by the conditions and circumstances outside of school. And these are described by some as the non-academic needs of these students. This particular strategy gives attention to the school as a focal area of change. Efforts have been made to formally and informally work within the context and structure of reform to resolve critical issues and to meet the students' needs, sometimes through reorganization and or revision of staffs and programs. Other efforts have involved the development of specific programs to address identified needs. For an example, impediments to student achievement, like attendance, behavior, and performance. Noted here will be the sharing of two examples of contemporary initiatives designed to relate to Strategy 1. The University of Chicago's Consortium on Chicago School Research identified 5 essential supports to improve academic success for students in schools in high poverty neighborhoods. These include school leadership, parent-community ties, professional capacity, student-centered learning environments, and instructional guidance. Although there were documented successes, they have concluded at the University of Chicago that in most impacted neighborhoods, more supports were needed, and these would include such important areas as safer schools that reflected the involvement of teachers and parents working together in partnership in the educational process, students feeling that their teachers cared about them and that their learning and well-being and their responsiveness to their needs was most important to their teachers, recognizing and seeing the importance of respect and trust, processing and filtering punitive measures, and improving the provision of adequate staff so that teachers were not required to provide non-academic or extended efforts and were not overwhelmed by responsibilities outside of their instructional program, except in the areas where they were providing support for students and recognized students' needs and gave students a different kind of focus as they worked with them. A particular program notable for its distinctive awareness of the need to address academic and non-academic needs of students is the Diplomas Now program. And our most familiar and immediate example of Diplomas Now acknowledges that it recognizes the need to ensure that particular emphasis are being placed on credible responses to students' academic and non-academic needs. In this respect, this program, Diplomas Now, is actually a collaborative that involves communities in schools, City Year, and Talent Development Secondary. Talent Development Secondary places emphasis on the academic needs of students, while Communities in Schools looks at the support systems and the related non-academic needs of students that may in fact involve their parents and community resources. And City Year primarily looks directly at establishing good peer relationships among the City Year employees and the students with whom they work. Graphically, there is a relationship clearly defined that shows that the center of attention for this effort is a concentration on the academic and non-academic needs of students, while the three entities designed specifically to address those needs find ways to collaborate so that they are strong in their presentation and their impact on student performance, and that they are able to coordinate the services they provide. The results are promising and have been noted in the various cities and school districts where diplomas now currently is functioning and being implemented well. There is a unique and specific program also that looks at the concentrated needs of students, but it looks at those needs in a very different way, and that way involves providing a response that means a removal of students from their living in concentrated poverty neighborhoods. And this removal includes their being placed in a residential setting that has an exclusive environment that is dedicated primarily to learning and providing learning supports. The results of the SEED school are promising. 90% of SEED students who enter the 9th grade graduate from high school. For comparison, 81% of all students across the nation graduate from high school. More than 90% of SEED graduates have been accepted to a 4-year college or university. More than 90% of SEED graduates have enrolled in college. For comparison, 52% of low-income high school graduates enroll immediately in college. 71% of SEED graduates have college degrees, are currently enrolled in college or an alternative post-secondary program, or are in the military. For comparison, only 11% of low-income first-generation students who enroll in college earn a bachelor's degree within 6 years. Let's move on and look at Strategy 2. Strategy 2 involves strengthening schools to provide enhanced social, health, and training supports to parents and to students from cradle to career. This is a tall task. One response has been through the development of community schools. There are varied descriptions and definitions of community schools, and a prominent recognized model appears within the Coalition of Community Schools. These generally support the involvement of such basic elements and strategies as wraparound academic, social, and emotional and health supports, school-based clinics, engaged parent and communities, expanded learning time that also includes after-school programming. A very specific and unique response to a community school-like program is seen in the Harlem Children's Zone. Clearly, a specific model that is dedicated to addressing the identified needs of concentrated neighborhood poverty in a specified community. In this case, a 100-block area of Harlem, New York. The important elements of the Harlem Children's Zone involve early childhood programs and public charter schools, academic advisors, and after-school programs for students who attend the regular public schools in the identified area, and support systems for former Harlem Children's Zone students who are in college. The Harlem Children's Zone has a varied components, and the components include a fitness program, an asthma management program, a nutrition program. Their neighborhood services and programs include organizing tenant associations, helping with one-on-one counseling for families, providing foster care prevention, offering community centers and supporting community centers, and employment and technology centers for teaching job-related skills to teens and to adults. It's worth noting that, according to data provided, the Harlem Children's Zone spends $5,000 per child annually for its educational program, while the New York City itself spends more than $50,000 each year to incarcerate one inmate. The results are impressive and have been acknowledged nationally and internationally. They include the following. 100% of Harlem's gyms, as they are called, the pre-kindergartners who are part of the program, were assessed as school ready. That's 100%. 95% of high school seniors were accepted into college. $20 million in scholarships and grants were awarded to their most recent college freshmen. 4,000 plus parents have graduated from the quote-unquote the Baby College Parenting Workshop Series. Over 12,000 children were served in the program in 2013. 1,450 students attended the Promise Academy charter schools. Over 12,000 adults were served in the year 2013. And $101 million was included in their annual budget for the year 2013. That included both private and public fund support. 954 of their students are currently attending college as of this report, and this is for the year 2014. And 1.4 million free healthy lunches and breakfasts have been served to students during this period by the Harlem Children's Zone. 4,000 children are getting 1 hour of exercise daily. We are looking at solutions and potential solutions, and it's worthy to note that there are national and local and state efforts to be responsive to the needs of children and students living in concentrated poverty. Worth noting is the work of the Promise Neighborhood. This U.S. Department of Education program was developed to provide funding to support eligible entities that included nonprofit organizations and institutions of higher education and Native American tribes to allow them to improve educational outcomes for students in distressed urban and rural neighborhoods. This includes a planning year that allows them to develop a comprehensive community program with a specific goal of preparing students for success in college and careers. Planners, applicants must focus on schools in challenged neighborhoods, and they must work to build services and supports for students from birth through college or career. Promise Neighborhoods results are commendable. As of 2012, the Promise Neighborhoods programs were operating in 20 states and the District of Columbia. Their emphases continued to focus on offering children high-quality health, social, community, and education services and support. Other communities are currently considering the Promise Neighborhood, that model, as a model worth replicating, and they would be doing so without federal support. The Promise Neighborhood Institute at Policy Link can offer technical assistance to communities and serve as a resource for training and providing the support tools that they need in this regard. As we continue looking at solutions, Let's consider strategy 3, strengthening the neighborhood. Choice Neighborhoods is a promising program offering a solution that is focused on the neighborhoods. Choice Neighborhoods is a program that supports locally driven strategies to revitalize neighborhoods by replacing distressed public or HUD-assisted housing with mixed income developments. It was preceded by Hope 6, and that was a program that emphasized finding ways to remove folks who lived in public housing and give them extended opportunities to live elsewhere. The Choice Neighborhood program emphasizes preserving affordable housing and a more comprehensive approach to neighborhood change. Stakeholders and residents come together to create and implement a plan that transforms a distressed HUD housing situation, simultaneously addressing the challenges of vacant houses. It was piloted in 2010 as part of the White House Neighborhood Revitalization Initiative. Collaboratively, it offers the opportunity for place-based planning for neighborhood revitalization in areas of concentrated poverty. Interim reports indicate that there have been both qualitative and quantitative approaches to monitor the impacts of this project in 5 specific neighborhoods and 5 specific original implementation sites. The Promise Zones are a dedicated response to the need to improve neighborhoods, and it's a president's initiative that looks to have collaboration occur between a variety of public and private faith-based organizations, along with community organizations, parents, and students, to ensure that students end up in situations that increase their ability to have decent living and good opportunities for improving their education. Currently, the Promise Zones are operating their first urban, rural, and tribal designations, and they were announced in a ceremony at the White House in January of 2014. They're located in San Antonio, Philadelphia, Los Angeles. They're also located in southeastern Kentucky and in the Choctaw Nation in southeast Oklahoma. It's expected that by the year 2016, 15 more designated areas will be identified as Promise Zones. Another response to the needs to improve neighborhoods is the Neighborhood Revitalization Initiative. And this is a collaborative supporting the Obama administration's approach to federal engagement in neighborhoods of concentrated poverty. The belief is that this alignment allows resources to effectively support local communities, government, business, and others in creating successful neighborhoods of opportunity. A place-based approach to helping distressed communities transforms into neighborhoods of opportunity. Specifically, the NRI program engages key federal agencies, the U.S. Department of Housing and Urban Development, the Department of Justice, and the Department of Health and Human Services. Its strategies include seeking opportunities to integrate the Choice and Promise neighborhood programs to ensure that federal funds are aligned and that local efforts are comprehensive.
1, 2, 3.
I have 4. This is slide 103.
Maybe we just delete this slide.
Yeah.
You want to delete this
Just
one?
delete it. That's enough on NRI. It's one way to get to the
We'll delete that one.
Mm-hmm.
Okay.
Continuing with solutions, we look at strategy 4, and that would be to provide residents with the means to leave neighborhoods of concentrated poverty. A response to this specific strategy is seen in the Moving to Opportunities program. In 1992, Congress authorized housing and urban development to implement in 5 cities, Baltimore, Boston, Chicago, Los Angeles, and New York, a randomized experiment involving families in public housing to receive vouchers for use in their housing. Findings of a follow-up study of the Moving to Opportunity program included the following: improved neighborhood outcomes, assignment to the MTO mobility groups led participating adults to feel safer and more satisfied with their housing and neighborhood. It had no effect on the labor market outcomes or social program participation of adults, but improved adults' mental health and some aspects of their physical health. Improved outcomes for female youth, but it had, on balance, only negative effects on male youth and their risky behavior. It had no detectable effect on the math or the reading scores and achievement of students. While we have shared some solutions and have considered the significance of some programs, a key critical need continues. That is the need to provide opportunities to look for ways to sustain what works. These opportunities would include giving consideration to replications and duplications, revisions, collaboration among researchers, practitioners, and clients, and increased involvement of parents, family members, adults in the home, and the support of the community.